Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Ané Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey veterinary rehabbers, today's episode is a revisit of one of our Onlinepethealth member sessions. It's a research refresh where we take clinical studies, we break them down, and we summarize the key takeaways so that you don't have to. So in this session, we review a pilot study looking at 50 dogs of different ages, all with various musculoskeletal conditions, who underwent a 5-week underwater treadmill program. The study reports improvements in range of motion across all the joints after the treatment period, which is really interesting when you start thinking about how this applies in practice. We also go beyond just the study itself, diving into how you can use your own clinical records to prepare for retrospective studies, what needs to be in place within your practice to make that possible, and some practical recommendations if this is something you'd like to explore. And importantly, we unpack the limitations of the study and how future research could be designed to give us more reliable, meaningful data. Now, if you're wanting to better understand research and start thinking about how it applies to your own practice, this is a really valuable episode. If you're interested in hydrotherapy, you're going to love this. We've put together a pool water management checklist that shows you exactly what to test daily, weekly, and monthly. You can download it for free at onlinepethealth.com/water test. Before we head over to that session, a quick word from our sponsors. Support, prevent, and rehabilitate. That's the Paw Prosper way. We've built a portfolio of industry-leading brands like Walking Pets, Help 'em Up, Respond Animal Therapeutics, Fit Paws, and Blue Nine to give your patients the gold standard in care. And we have some big news. Paw Prosper is officially the new home of the Canine Rehabilitation Institute and Onlinepethealth. We're bringing the best products and the best online education together under one roof to help you and your patients thrive. As a special hello to the OPH community, we're offering a one-time gift with your next order when you sign up today. You just have to head over to pawprosper.com/OPH and join the movement in pet rehabilitation. Right, over to Ané and the research refresh.
Good morning and welcome to our first research refresh for 2026. I hope that your year is off to a fantastic start. All right, today we are looking at a pilot study on hydrotherapy that comes from Poland. It is a pilot study on the effects of a 10-session underwater treadmill program on canine joint range of motion. So in terms of the introduction, we do have a few studies on canine hydrotherapy, so there are some things that we know. Most of the studies we have, though, are small and do have limitations, so I want to add that in. And we have covered most of them. Okay, so we know that underwater treadmill has been shown to increase joint range of motion and stride length after a single session. We have kinematic data that looks at spinal segment motion, and a variety of other articles available. And then when we look at the other components of this paper, the measurement of joint passive range of motion using a universal plastic goniometer is generally considered reliable and repeatable. So the aim of this study was to determine the effect of a 10-session underwater treadmill program on passive range of motion in the fore and hind limb joints of dogs with diverse musculoskeletal disorders. Furthermore, it was assessed whether therapeutic efficacy was influenced by the age of the animal. Okay, so in the study, they used the clinical records of 50 dogs that participated in a 10-session underwater treadmill program. So I love that they have a group of 50 dogs. They've used clinical records, so this is a retrospective study, which has its own limitations. It means that they could not have a control group included, and it means that there's no randomization or standardized inclusion and exclusion criteria, and there's a greater risk of uncontrolled confounders, together with inconsistent documentation, which could affect data quality. You also open yourself up to some biases when using a retrospective study method like this. However, I think that this is a really good study design for us to consider, because it means that we can use, for us to consider if we want to pursue research as clinicians, because it means that if we set up our record taking in some specific ways, we can use our clinical records to conduct retrospective studies in the future, which I think is very valuable for us in our profession. Okay, the dogs in the study were referred for underwater treadmill therapy owing to different musculoskeletal or neurological disorders. All patients completed a medical or surgical treatment, and they were considered clinically stable when they were enrolled for hydrotherapy. The disorders that these dogs had included orthopedic and neurological conditions typically encountered in rehab, so intervertebral disc disease, hip dysplasia, spondylosis, cauda equina syndrome, patella luxation, elbow dysplasia, and post-op recovery following femoral fracture repair. In every case, hydrotherapy was initiated after the exclusion of acute inflammation, pain, or other contraindications to underwater treadmill exercise. All right, so yes, they had 20 dogs, but because we have so many diverse breeds and so many different conditions represented, this is another limitation or drawback of the study, because there's so much heterogeneity introduced into the study design. If we're looking at passive range of motion, the size of the dog is going to influence that change. And so if they haven't accounted for that in the data analysis and in the statistical analysis, that is a problem, especially when we're considering weight variations from 47 kilograms down to 3 kilograms. That is quite a varied range of different weights. Each disease process has its own pathophysiology, its recovery trajectories, and its responses to hydrotherapy. And so pooling them all together really increases the noise and reduces the ability to interpret condition-specific effects, right? It also means that with each condition, the population becomes too small for us to really do anything with the data for that condition. Intervertebral disc disease represents 20 cases, so that's a decent population size. Hip dysplasia, 12 cases. Spondylosis, 8 cases. And then from there, 4, 3, 2, and 1 cases, that really doesn't give us data that we could take into, that we could apply across the board to that condition. Let me say it that way. Okay, so they used a water walker underwater treadmill. All underwater treadmill sessions were conducted by the same certified canine rehabilitation therapist. The underwater program consisted of 20-minute sessions, which excludes the familiarization process. It was conducted twice weekly over 5 consecutive weeks. So 2 sessions per week, 20 minutes each for 5 weeks. The water level was set at approximately 3/4 of the femur length, as this depth provided optimal buoyancy and resistance during underwater treadmill exercise. So I find that interesting. The water level was not adapted for the patient requirement or the patient's condition, but was kept at one set height, and all patients underwent the same 20-minute sessions. They don't mention how long breaks were. So from a clinically applicable perspective, this is a limitation in terms of we did not have individualized programs applied for individual patients. They all underwent the same program. But from a research perspective, this is a strength. It means that the intervention applied was the same for all patients, and so that adds some added robustness to the study design, which is good. A treadmill speed of 1.2 meters per second was used as the primary setting, but of course if you have dogs ranging from 47 kilograms to 3 kilograms, you do need to adjust that speed according to the individual dog. So speeds ranged from 0.9 to 1.3 meters per second. Here I would love to know whether or not the speed was controlled for each individual patient. Did the Dachshund number 1 always walk at 0.9 meters per second, or was that adjusted from treatment to treatment? Water temperature was maintained between 26 and 30 degrees. And all dogs included in the study did not receive any additional physiotherapeutic or pharmacological treatments during the 10-session underwater treadmill program. So that is another strength. If the patients were only receiving one intervention, it makes it more likely that that intervention is leading to the results. However, we don't have any control or any alternative treatment programs to be comparing results to, and that is definitely a limitation. Informed consent was obtained from each dog owner. Passive joint angles of extension and flexion were measured using a transparent plastic goniometer, following the procedures described by Rusing. So measurements were performed with the dog positioned in lateral recumbency, both left and right sides. For each dog, passive range of motion was measured in the carpus, elbow, shoulder, tarsus, stifle, and hip before and at completion of the 10-session underwater treadmill program. Each angle was measured 3 times, and then the mean values were calculated for each joint. All measurements were performed by the same examiner. That does increase consistency or accuracy. However, the same examiner did the goniometer measurements and the hydrotherapy intervention. So they were not blinded to whether this was an initial or a final consult. They also don't specify whether there was blinding of previous measurements. So for example, if I think of clinical forms, very often we will have a table with, week 1 and then week 6, or whenever you do your first follow-up measurements, and you'll have those measurements sitting next to each other on the same form. So when you are measuring the second measurement, you will see 36 degrees of flexion, and then you will measure 38 degrees or 34 degrees, and then you'll be able to say, oh look, there's been a change or an improvement. That degree of blinding, of course, we are biased as clinicians. We want to see change and improvement in our patients, and so from a clinical perspective as well as a research perspective, we should have some blinding occurring, and from that perspective, I think it is beneficial if a separate clinician performs the evaluations to the clinician that performs the actual treatments. That can be an advantage in terms of the accuracy of our results, and there should be blinding while you're taking the measurements of what the first measurements were. You shouldn't see them when you're taking the second measurements, and that will also increase the accuracy. Of course, you want the same person to be doing the pre and the post measurements, so that is good. Okay, so results. The 10-session underwater treadmill program resulted in a reduction in flexion angles in all evaluated joints: carpus, elbow, shoulder, tarsus, stifle, and hip, and they were all significant, okay? And they were all significant across all conditions. So that's awesome. Here are the measurements, and the same is true for extension angles. There was an increase in all extension angles in all joints, which was statistically significant. Sorry for stumbling over that. Okay, so all of our joints had an increased passive range of motion, greater extension and less flexion, so greater flexion. All right. Here, these box charts are useful to see. We can see the before and the after. I like that in the carpus our after measurements are tighter. That's good, and we can see that in all joints there was a change that was statistically significant. But what I want to add is, even though they are statistically significant, these changes are still small. We're seeing median passive range of motion increases of between 1.9% and 5.6% depending on the joint, and statistical significance does not equal clinical relevance. Okay, so without functional measures like gait, pain, owner feedback that relates to functional ability or functional capacity, we don't know how the modest change in range of motion will impact the clinical presentation and functional ability and capacity of these patients. We can't link those together from this research. All right, they also looked at age, okay, and in all cases, the correlations were not statistically significant, which suggests there's no meaningful relationship between the dog's age and a therapeutic response. Regardless of how old the dog is, we are going to see an improvement in passive range of motion over 5 weeks when the dog undergoes 2 sessions of hydrotherapy, 2 hydrotherapy sessions per week for 5 weeks, 20 minutes each at that mid-femur level water height. Okay, so this is the percentage of passive range of motion improvement. Didn't want to go through everything here. They do mention that the lack of control, there was no control group. The study should be regarded as a preliminary pilot study. Then they do look at, for example, in dogs diagnosed with hip dysplasia, the pattern of changes in joint mobility observed in the study resembles that reported by a previous research article. They evaluated 12 hydrotherapy sessions in a comparable clinical population. In this cohort, they had 12 hip dysplasias. Hip flexion decreased from 47 to 45, while extension increased from 155 to 159. Okay, so a mean passive range of motion increase of 6 degrees. Right, and here they say that while statistically significant, these results should be interpreted with caution, because without functional and quality of life outcomes, we can't say that an increase in joint range of motion, passive range of motion, has resulted in an improved quality of life or functional capacity of the dogs. Okay, so in conclusion, a 10-session underwater treadmill program was associated with improvements in both flexion and extension angles in all evaluated joints of the thoracic and pelvic limb in dogs. These effects were observed across the defined diagnostic groups, across conditions, including the group combining several less common disorders, and did not appear to depend on the dog's age. Okay, so if we are considering doing retrospective studies like these, how would we want to set ourselves up for that? I think it is always a good thing to review how we are taking notes, how we are reporting, what is our reporting process like. The more consistent we are, the more consistent we are with that reporting, and the clearer we are with that reporting, the more valuable our clinical notes will be in terms of being able to pull them for a retrospective study. I think it is worth looking at things like blinding to previous measurements, having a separate clinician doing the treatments and the measurements, doing the reevaluations or reassessments, And then, of course, when we are including multiple interventions, which we are most of the time doing, that does confound our clinical notes, right? If we're using multiple modalities and we're adjusting those modalities from treatment to treatment, that makes it tricky. So in terms of that, having a clinical setup like this, where you are selling a 10-session package and it has the same format all the time, I don't necessarily think that is the best thing for the patients, but that does help us from a study perspective. So have a great day.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paul Prosper. Their sponsorship allows us to be able to give this podcast to you for free. So go and check them out at paulprosper.com. And also don't forget to bookmark the next Vet Rehab Summit on Saturday, the 14th of November, 2026. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Online Pet Health members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.